Welcome back to Lender Brothers Veterinary Centre's Arthritis Talk. We've done A is for analgesia, well, pain relief, and now we're looking at body weight. This is a very important part of arthritis because, as you can see with this dog, if you carry this amount of weight around, it's going to really have a good chance of damaging your joints. It's a real vicious cycle. If an animal is overweight, it may develop arthritis and therefore obviously not be able to exercise, more likely to put on overweight, and it goes round and round and round. It can start at any point. And this is where we need the nurses to come in. The nurses at the practice here run our weight loss clinics. If they carefully get the weight down of these dogs, we have reduced joint load, greater exercise tolerance, and therefore they're going to lose weight. So we're moving the cycle in a much more positive direction, but it has to be done very carefully. B really isn't for body weight. It should really be B for body condition score. Because you get big Labradors, small Labradors, you get muscly animals, and the weight will go up and down with the muscle mass. So what we do is we feel the animal and we look at it and we body condition score it. And this goes from 1 to 5. 1 being very thin, emaciated animals. Thankfully, we very rarely see animals at number 1 at all. 2, they are still thin, they're underweight. These are the animals that, as the young animals normally, they're working very, very hard, and we just need to up their nutrition because their ribs are sticking out and they're just basically not able to get enough nutrition in to match their requirements. The ideal is this. This is the silhouette we want to see. Every dog should have a nice tucked up waist, so should a cat. You should be able to feel their ribs easily by running your hands over the rib cage. I'm afraid this is the more usual situation. Most of the patients that we see are just slightly above their normal weight, and this is just through changing culture of owning a pet, in the fact that dogs don't get quite as much exercise anymore. Cats are more likely to be indoor cats, and they therefore don't get out and exercise as much as they used to. And a lot of the pet foods out there are far too rich. The cheaper pet foods we tend to feed, and the feeding guides tend to get people to feed too much food for that dog's or cat's weight. So we are seeing a lot of these animals, they've lost the little tucked up waist. You're starting to have to press to feel the ribs, and these animals are in danger of going on to develop arthritis. I'm afraid we do still see markedly obese animals come through the practice on an almost daily basis. These animals are in real trouble. We can see the fat is causing their bellies to hang down. We can hardly feel their ribs at all. They're really sort of plastered in fat, and they are carrying around an enormous amount of weight. And that's the fat that we can feel and see on the outside. There is also lots of fat inside their chest, inside their abdomen, and they're not going to want to exercise because their lung capacity is reduced. So it's a careful weight loss program to get them back fit and get exercising again. So how can we safely lose the weight once it's there? Well, the first thing the nurses will do is calculate what's going into the animal's mouth, what energy is being put into their mouth, and that includes all the tidbits that people feed. These are a real no-no for pets because they tend to be very high in calories, either high in fat like cheese or dairy products, or high in carbohydrates like biscuits, anything sweet tasting. And once we've done that, we then basically work out what ration of dog food or cat food they're on and adjust that. Sometimes we can get away, if they're only mildly overweight, we can get away with reducing the volume of the ration that they're on. This can be a problem with some pets that are either very food orientated or quite overweight, because you can cut the volume down so much that they're looking for food constantly. They don't feel full, so they'll either visit other people's houses if they're cats, or they will go out and scavenge if they're dogs, and that can include eating their own poo. The other thing is, if we cut the volume back so much, they may end up getting less vitamins and minerals, as well as all the other things that we're trying to restrict them in terms of calories. So what we do with these patients is we put them on a calorie reduced obesity diet. It's a veterinary recommended diet that is very low in calories. It's quite high in protein, because one of the first things the body will try and do is lose lean muscle mass rather than fat. Trying getting the body to burn fat is quite difficult because the body wants to hang on to it for the hard times ahead, the cool winters and all those sorts of things. So what we can do is feed high protein, especially one particular protein, L-carnitine, which acts as a fat carrier, and that promotes fat burning early in that dieting period. So that's very useful. The other thing about these diets is the pet food manufacturers, the good ones, realise there is a link between obesity and joint problems. So they've put things like glucosamine into the diet, all these good nutritional supplements, and that's really to stop you having to add these things in, because the supplements that you get from the shop quite often have carbohydrate associated with them, or other proteins, which acts as a treat in effect. So it's a way of making sure that the only thing you need to put into your pet's mouth is this diet and water. Careful, controlled weight loss is what we're looking for. This is an actual graph of one of the pets that went through one of the nurse clinics, and as you can see, we were weighing this animal every 2 weeks, which is what we want to do, because if the weight loss is too severe, as we can see at the start it was very steep, we then back it off a little bit and make sure it's a nice controlled weight loss, because each animal is very individual and it will respond in a different way. So by weighing each animal every 2 weeks and adjusting the ration, we can smooth that curve off. Cats, we've got to be very, very careful. If we crash diet cats, it can result in a condition called hepatic lipidosis, which can be very easily fatal in cats. So we want to be very, very careful that they are eating the diet, that they are actually losing weight at a nice controlled level. And once they're down to their ideal target weight, then we can then put them onto a diet that's suitable to keep them at that level. And obviously, if they've lost that body weight, they'll be exercising more, and it'll be easier to keep them at that ideal weight, at that body condition score 3. So that's B for body weight. Join us for C.